Okay, 42-year-old again. Uh, 42-year-old, weight gain, dry hair, edematous face makes me think of hypothyroidism. Sister has had similar symptoms. There's microsomal antibodies. Antimicrosomal makes me think of primary biliary cholangitis. And just remember that the PANCA is associated with primary sclerosing cholangitis. This is more prevalent in men. This is more prevalent in women. This is kind of sclerosing. This is granulomatous, and uh, primary biliary cholangitis is intrahepatic. Primary sclerosing cholangitis is intra and extrahepatic. Okay. Which of the following is most likely complication of the patient's condition? Okay, so she's got some sort of autoimmune stuff, right? That's usually a risk factor for B cell lymphomas. Okay, just take that as face value. A, yeah, autoimmune condition risk factor for B cell lymphoma. 40-year-old, she wants to know what's her risk is for developing breast cancer. Her mom recently died. Physical exam is normal. Mammography is normal. Oh, actually, mammography shows suspicious lesion and then needle biopsies performed. She's diagnosed with lobar carcinoma in situ, right? Lobar carcinoma in situ, lobular carcinoma in situ. Okay, almost lack of ecatrin. So, uh, lobar carcinomas, whether it's in situ or it's like a proper carcinoma, is ecatrin is a big like thing that happens. And again, this is something that connects two cells together, right? And losing it is kind of like a big no-no for cancer cells because it means they can start getting everywhere. And remember that not carcinoma in situ, but lobar carcinomas, they're like histologically they're cells in columns, and you can think of it as like these kind of like connections between these two cells broke, so they used to be circular and now they're like in a line. Yeah, lack of egalitarians, right? And oh, this one happens bilaterally a lot. I don't know why. It's it's not metastasis. It's just co-occurrence. Couldn't be metastasis from one breast to another. 13-year-old, low blood pressure. Hair on the face. So hirsutism, low blood pressure. Hirsutism tells me 17 is intact, right? For a girl, if you have more facial hair, that means you're producing more androgen. 17 makes androgen, so 17 is intact. And you got low blood pressure, right? What does that tell me? That means no kind of like what mineralocorticoids are being produced. That means if I were to choose between 11 and 21, because it goes from 11 first to like something, and then sorry 21 first, then some product, and then this is like aldosterone. Um, and this has some mineralocorticoid activity. This has mineralocorticoid activity, and because here we have like a big loss, we have no mineralocorticoid activity, which means this or this aren't being produced. So we have the 21 deficiency. But let's read on, and we got clitoromegaly, and we got high potassium. Again, like reinforcing our hypothesis up here. So we got a 21 deficiency, right? 58-year-old woman, red itchy rash on the right breast around the nipple. She's been smoking for 30 years. And since she was a teenager, there is there's some crust. There is calcifications on right breast, which is suspicious of underlying breast cancer. Okay, okay. So this is pageant disease, right? You got some cutaneous stuff, purely cutaneous stuff like rash and like eczema, stuff like that. And then you got a cancer that basically just means the cancer cells. So if this is your breast, this is your breast, right? This is the nipple. This is like the caniculi that like the ducts. It means there's a cancer here, and it just made its way up here, and then it's like kind of climbing out, and you see this rash. This is your eye. You see the rash um, physically here. So, but what histologic finding? So you'd have to see some sort of like cancer cells within normal skin, and these cancer cells like are big basically. They're bigger. They're hypochromatic. They're hypochromatic, but they have hyperchromatic nuclei, and that just means abnormal nuclei, right? The nuclei are darker than normal because these cells are cancer cells. So sheets of small blue cells, single file arrangement. This is again lobular carcinoma. Tumor cells around normal. Canine ducts. This is like a carcinoma in situ. Necrosis calcification. This is like that special type of ductal that get necrosis and calcification in the middle. So it's a pageant disease. So yeah, you gotta. So when you have pageant disease of vulva, doesn't necessarily mean there is uh, or like extramedullary pageant disease. Kind of same idea happens in the vulva, but in that case, it doesn't mean there is a underlying cancer. In this case, it means there is for sure an underlying cancer, and you got to look for it. 20-year-old lump in her left breast. It's mobile, 2 centimeters. Oh no. It changes size with her menstrual cycles, right? Okay. So I'm just thinking of like a fibroid kind of thing, the fibroid tumor. Um, okay. Let's start reading. Enlarged terminal duct lobule up here. This one isn't. This one happens in the leaf-like one is the one that happens in elderly, just a 20-year-old. Myxoid, fibrillous. Uh, I don't like this question, but I'm gonna go with C. It's A. It's A. It's not a good question. I don't like it. 53-year-old. Oh, here, leaf-like structure, right? Uh, they remove it. Which of the following is so basically this tumor has leaf-like structures. It's not malignant by itself, but it's really irregular, right? And when they remove it, there's always a chance of like leaving some stuff out, and um, that causes recurrence, basically. This question I didn't agree with, but we have we'll read and explain why they say what they say. 42-year-old has Crohn's disease. Is basically this guy or girl. This guy is basically on corticosteroids, right? So what you expect is that they're on like prednisone or something, so they will have as part of negative feedback. They'll have low ACTH. They'll have high glucose too because well they're just like under a lot of corticosteroid like signaling that causes liver to pump out glucose, so you get high glucose, right? But what I disagree here is that this part, the low cortisol level. So I would think that if you have low ACTH, you'd have low, and cortisol is endogenous, right? So you'd have the low endogenous cortisol, and you'd have like some sort of drug, like a cortical, like a dexamethasone or something else. That one would be high. But the answer is E, And so like this middle one, I guess like what they're thinking is that, oh, so the person is taking cortisol like as a drug. So that would be exogenous. That's why it's high. 57-year-old, um, so has breast cancer probably, yeah, and is positive for estrogen receptor, so we give him tamoxifen. Remember, tamoxifen is a progesterone receptor agonist in the breast, but in the like a endometrium, it is like like progesterone estrogen receptor. It's like mostly estrogen. It's an it's an antagonist in the breast, but it's an agonist in the endometrium. So it like stimulates endometrium for growth. So we get hyperplasia of the endometrium. Okay, let me move myself to this. I don't know why this has an answer but no highlights. Okay, 32-year-old female, weight loss, feeling warmer, so somehow hyperthyroidism. Uh, Use of thalamus. Okay. Oh, so this asks which of the following. Uh, we have thyroid stimulating hormone, but which of the following symptoms are specific to this condition? Exophthalmos is specific to Graves, and this is Graves. I mean, weight loss, palpitation, sweating, heat intolerance. Really not specific to anything. Okay, 25-year-old, cramping, stool is mix of blood and mucus, some weight loss, left lower quadrant tenderness. That makes me think of like Crohn's so far. But let's read on. Continuous ulceration. So why did it make me think of Crohn's? Because Crohn's happens on the left side because it's towards the end of the column. Whereas, sorry, ulcerative colitis made me think of ulcerative colitis. Ulcerative colitis happens on the left side more, because it's like end of the column. It starts there, and it like continuously makes its way up, cross, and down. Let's see, this is like the rectum here, down to the cecum and stops at cecum. Whereas Crohn's usually, this is like this, let's say it's in small intestine in the middle. Crohn's usually like happens here, in the terminal ileum, where it connects to the large intestine. So what do we see on histology of ulcerative colitis? Uh, we see superficial ulcers, as the name suggests. Okay, so this is really easy. Uh, let's see if I. It's not so easy. It's actually micro. What am I saying? Micro. Okay. 46-year-old. Pain radius to back, abdominal pain at radius to upper back. So consumption of alcohol makes me think of pancreatitis. Has a little bit of fever, high pulse. Blood pressure is okay, not too low. Amylase is high. Lipase is high. WBCs are high. So, this guy has some sort of pancreatic problem. Uh, and then which one find associated with patient's condition? So pancreatitis leads to ARDS. The way it does is that it releases basically enzymes that are destructive to the alveoli, and so they destroy the alveoli and they cause respiratory distress. Simple, right? And this is like cholecystitis not related to pancreas. Chronic gastritis not related to pancreas. Um, this is acute pancreatitis, and if you have one episode, it's not necessarily uh, associated with carcinoma. But if you have chronic, or if you're an alcoholic and you keep like doing the same, like keep stressing your body with alcohol or pancreas with alcohol, then yes, you are at risk of developing pancreatic cancer. 40-year old, but in that case, it would be like a chronic pancreatitis induced as a result of a lot of acute episodes of acute pancreatitis. So, 40-year-old um, has spooning on the nails. You see like low hemoglobin, MCV is low, right? So let's see if there's any other clues here. No, so it's based smooth. Oh, smooth edematous tongue. So you got glossitis. So you got edema of the tongue, right? And difficulty swallowing is what I was looking for, right? So you got difficulty swallowing, one, anemia, two, and you got tongue inflammation, three. That is the plumber something syndrome. And so these guys, another thing they have is esophageal webs, which is like these like things that protrude out of the esophagus that causes food and stuff to get stuck here, irritate the esophagus, and this is like doesn't happen like where the stomach is. It happens a little bit higher. It's not as a result of acid damage, so it's not doesn't lead to adenocarcinoma of the esophagus. It leads to squamous cell carcinoma of the esophagus. All right, so man is itchy, is probably has jaundice, uh, has had colon resection. One of the reasons you would have colon resection is what? Is ulcerative colitis, right? Um, but also you see beads on a string appearance of the ductal of the bile ducts. Beads on a string is biliary sclerosing cholangitis. This guy is also a man. This guy is also itchy. Probably has jaundice, but you know hasn't been mentioned. And also intra and extrahepatic bile ducts, right? So this PS, uh, primary sclerosing cholangitis, two things you gotta know about it is associated with pianca and associated with ulcerative colitis. So this guy has ulcerative colitis. Okay, from now on I haven't looked at these questions before, so we're gonna do them together. Do not worry. 35-year-old man, uh, has abdominal pain after meals, uh, takes antacid, aspirations are 14, upper GI endoscopy. Okay, so it's got basically you do upper GI endoscopy. There's like curve like organisms. That's probably H. pylori, mucosal atrophy. Is the organism is urease positive, so it's definitely H. pylori. So it's asking what also will we see? So we know we're gonna see like an ulcer. Uh, so flash shaped ulcer is not this. What we see is remember one of the things this can cause is a limb. Uh, these don't have answers either, but it's a lymphoid aggregate. It's a reactive lymphoid aggregate, to my opinion. I'm actually gonna stop this video here. Wait, I can pull up the answers so we can check if we get things right or not. Actually, I'm gonna pause this.